Welcome to the world of nursing, a profession defined by compassion, knowledge, and unwavering patient care. As you step into this noble field, you're joining a community dedicated to making a difference in the lives of countless individuals. As you embark on this rewarding journey, you'll encounter various milestones designed to equip you with the skills needed to excel. These milestones are not just academic hurdles, but essential experiences that shape your professional identity and competence. One such crucial milestone is the Objective Structured Clinical Examination, or OSCE, a critical component of nursing education and assessment. OSCEs are designed to test your ability to apply theoretical knowledge in practical, real-world scenarios. OSCEs are meticulously crafted to evaluate your clinical proficiency, communication skills, and professional demeanor in simulated healthcare settings. These exams simulate real-life situations, allowing you to practice and refine your skills in a controlled environment. They provide a vital bridge between theoretical knowledge and real-world application, ensuring you are well prepared to deliver safe and effective patient care. This hands-on experience is invaluable, as it helps you build confidence and competence in your clinical abilities. Think of OSCEs as your opportunity to shine, to demonstrate the culmination of your hard work and dedication. Each station in an OSCE is a chance to showcase your skills, from patient assessment to clinical decision-making and communication. They're not merely examinations, but stepping stones, guiding you toward becoming confident, competent, and compassionate nursing professionals. These experiences help you develop a deeper understanding of patient care and the complexities of the healthcare environment. Embrace the challenge, for within these simulated scenarios lies the potential to hone your skills and solidify your passion for patient care. Each scenario is an opportunity to learn, grow, and improve, preparing you for the diverse and dynamic nature of nursing. Remember, you are not alone in this journey. Your educators, mentors, and peers are here to support you every step of the way. Their guidance and feedback are invaluable resources that will help you navigate the challenges and triumphs of your nursing education. The journey through nursing school is demanding, but it is also incredibly rewarding. Each OSCE you complete brings you one step closer to becoming a skilled and compassionate nurse, ready to make a positive impact on the lives of your patients. So, take pride in your progress, celebrate your achievements, and look forward to the future with confidence. The skills and knowledge you gain through OSCEs will serve as the foundation for a fulfilling and impactful nursing career. In conclusion, OSCEs are more than just exams. They are essential experiences that prepare you for the realities of nursing. Embrace them with enthusiasm and dedication, knowing that each step brings you closer to your goal of becoming a compassionate and competent nurse. Your journey is unique, and every challenge you overcome is a testament to your resilience and commitment. Keep pushing forward, and remember that the skills you develop through OSCEs will be the cornerstone of your nursing practice. Thank you for joining us on this exploration of the importance of OSCEs in nursing. We wish you the best of luck in your studies and future career. Keep striving for excellence, and never forget the profound impact you can have as a nurse. OSCEs are, in essence, a series of simulated clinical scenarios designed to assess your ability to apply theoretical knowledge in practical settings. Imagine them as theatrical stages where you, the nursing student, take on the role of a healthcare professional, navigating real-life situations with standardized patients trained to portray specific conditions or concerns. These scenarios are carefully constructed to mirror the diverse challenges you'll face in your nursing career. During an OSCE, you will be presented with a specific clinical task or communication challenge. This could involve anything from taking a patient's blood pressure to educating them about their medication or delivering sensitive news with empathy and tact. The beauty of OSCEs lies in their ability to evaluate not just your clinical skills, but also your ability to communicate effectively, think critically, and respond appropriately under pressure. Remember, OSCEs are not about rote memorization, they are about demonstrating your understanding of holistic patient care. Now that you have a grasp of what OSCEs are, let's explore their structure and flow in more detail. Understanding the typical structure of an OSCE station is crucial for your preparation and success. Each station is like a mini performance, typically lasting around 10 minutes, and follows a structured format to ensure consistency and fairness. This format helps standardize the assessment process, making it fair for all candidates. Before entering the station, you will be given a brief outlining the scenario, your role, and the specific tasks you need to perform. This brief is your roadmap, providing essential details that guide your actions during the station. Take a deep breath, visualize yourself successfully navigating the scenario, and step into the station with confidence. Visualization can be a powerful tool to calm your nerves and mentally prepare you for the tasks ahead. The station itself will be set up to resemble a realistic clinical environment, complete with the necessary equipment and resources. This setup helps simulate real-life situations, allowing you to demonstrate your skills in a controlled yet authentic setting. You will interact with a standardized patient, or in some cases a mannequin, and perform the required tasks to the best of your ability. These interactions are designed to test not only your clinical skills, but also your ability to communicate effectively and empathetically with patients. An examiner, often a nursing educator or experienced clinician, will observe your performance, assessing your clinical skills, communication, and professionalism based on a standardized marking scheme. Their role is to ensure that you meet the required competencies and to provide an objective evaluation of your abilities. Don't worry, they're not there to intimidate you, but to evaluate your competence and provide valuable feedback for your growth. Constructive feedback is an integral part of the learning process, helping you identify areas for improvement and build on your strengths. After the station, take time to reflect on your performance and discuss your experiences with peers. Sharing tips and strategies can be incredibly beneficial, as it allows you to learn from each other and gain new perspectives on how to approach different scenarios. Use the feedback provided to refine your skills and prepare for future stations. Continuous improvement is key to mastering the OSCEs and becoming a competent healthcare professional. Remember, preparation is a journey, and every step you take brings you closer to your goal. Practice diligently, support each other, and stay focused on your objective. With dedication and perseverance, you will succeed in your OSCEs and beyond. Pause 3S. Let's delve into a crucial aspect of OSCEs that often goes overlooked, but is vital for patient care, managing patient anxiety during procedures. As a healthcare professional, your clinical skills are essential, but your ability to manage a patient's emotional state can significantly impact their experience and outcomes. Imagine this scenario. You enter the OSCE station and the briefing sheet instructs you to measure the blood pressure of a patient who is visibly anxious about an upcoming procedure. This situation is not uncommon and tests your ability to handle patient anxiety effectively. First, always start by washing your hands before approaching the patient. This simple act is not only a standard protocol, but also an opportunity to demonstrate your professionalism and commitment to patient safety. Approach the patient with a warm smile, introduce yourself, and explain the procedure in clear, concise language. This initial interaction is crucial in setting a positive tone. Next, acknowledge the patient's anxiety. Use empathetic statements like, "I understand that you might be feeling anxious about this, and that's perfectly normal." This acknowledgement can go a long way in making the patient feel understood and supported. As you prepare to take their blood pressure, continue to communicate clearly. Explain each step of the process and let them know what to expect. For example, say, "I'm going to wrap this cuff around your arm and you'll feel it tighten for a moment. It's just measuring the pressure in your arteries." Throughout the procedure, maintain a calm and reassuring demeanor. Your body language, tone of voice, and facial expressions all play a role in conveying reassurance. If the patient expresses any concerns, take the time to listen and address them thoughtfully. Once you have obtained the blood pressure reading, communicate the results to the patient in an understandable manner. Explain what the numbers mean and how they relate to their health. This helps demystify the process and empowers the patient with knowledge about their condition. Finally, offer reassurance. Let the patient know that their anxiety is understandable and that they did well during the procedure. Encourage them to ask any further questions they might have and provide clear, concise answers. Managing patient anxiety is not just about clinical competence, but also about building a rapport and trust with the patient. By combining technical skills with compassionate communication, you can significantly enhance the patient experience and excel in your OSCEs. Remember, every interaction is an opportunity to make a positive impact on a patient's well-being. Practice these skills diligently, and you'll be well prepared to handle any scenario that comes your way. Section 4. Mastering the clinical blood pressure measurement. Let's bring the OSCE experience to life with a specific clinical example, measuring a patient's blood pressure. This is a critical skill that every healthcare professional must master. This seemingly simple procedure is a fundamental skill in nursing, and it plays a crucial role in monitoring a patient's health status. An OSCE station assessing this skill will evaluate not just your technical proficiency, but also your ability to interact with and reassure the patient. Effective communication is key, as it helps in building trust and ensuring the patient feels comfortable and informed throughout the process.
Imagine this. You enter the station, and the briefing sheet instructs you to measure the blood pressure of a patient who is anxious about an upcoming procedure. This scenario is common and tests your ability to handle patient anxiety. Your approach and demeanor can significantly impact the patient's experience. It's important to remain calm and composed, providing reassurance through your actions and words.
First and foremost, always wash your hands before entering the clinical station. This simple act is crucial in preventing the spread of infections and ensuring patient safety. Approach the patient with a warm smile, introduce yourself, and explain the procedure in clear, concise language. This initial interaction sets the tone for the entire process. Ensure they understand why you're taking their blood pressure, emphasizing the importance of this measurement in assessing their health. Address any concerns they might have, taking the time to listen and respond empathetically. This helps in alleviating their anxiety and builds a rapport. Remember, effective communication is paramount in putting your patient at ease. Your ability to explain the procedure and its significance can make a big difference. Use simple language and avoid medical jargon that might confuse or intimidate the patient. Reassure them that the procedure is quick and painless.
Next, demonstrate your clinical expertise by selecting the appropriate cuff size, positioning the patient correctly, and placing the stethoscope accurately. These steps are crucial for obtaining an accurate reading. Ensure the patient is seated comfortably with their arms supported at heart level. This positioning helps in getting a precise measurement. As you obtain the reading, communicate the results to the patient in an understandable manner. Explain what the numbers mean and how they relate to their health. Answer any questions they may have, providing clear and concise information. This helps in demystifying the process and making the patient feel more informed and involved in their care.
Absolutely. It's all about combining technical skills with compassionate communication. Mastering this balance is key to providing excellent patient care and excelling in your OSCEs. Section 5. The Art of Communication, Breaking Bad News. Now let's shift our focus to a communication-based OSCE scenario, breaking bad news. This challenging yet essential aspect of nursing requires empathy, sensitivity, and a deep understanding of effective communication techniques.
Imagine the scenario. You are tasked with informing a patient about a difficult diagnosis or prognosis. This station will assess your ability to deliver this news with compassion, clarity, and emotional intelligence.
Begin by creating a safe and supportive environment for the patient. Close the curtains to ensure privacy, sit at eye level, and maintain open and compassionate body language. Use clear and simple language, avoiding medical jargon, and allow the patient ample time to process the information.
Be prepared for a range of emotions, from shock and denial to anger and sadness. Listen actively, validate their feelings, and offer support and empathy without offering false hope.
Remember, breaking bad news is not just about conveying information, it's about providing emotional support and guidance during a difficult time.